Before we get started, be sure to complete your medical and lesion history in the app. To provide all the details your CheckMySpot screener might need for an accurate assessment, first mark the location of your lesion on the diagram shown. Next, you'll want to use a black ink pen to circle the spot in question on your skin. Draw a border around the lesion while leaving some normal, unaffected skin showing inside the circle. After marking your lesion, you're ready to take and upload some photos. For the best results, try to take your photos near a window or a source of natural light with the light behind you. We'll start with the location photograph. You'll need to identify a nearby landmark to include with the photograph that will help distinguish right from left. Some commonly used location landmarks include eyes, elbows, thumbs, or soles of feet. Take a photo that includes your chosen landmark along with the marked lesion. You'll want to center your concerning skin spot in the photograph so that it's the main focus, but we know it's not possible to do so in every situation. Check for shadows in the frame and be sure to hold the camera still to avoid any blurriness. With most smartphones, there's also an added spot metering option. To do this, simply tap the screen so that the yellow box focuses on the lesion you're trying to photograph. Take a look and review your photo. Is the identifying landmark in the frame? Is the photo in focus and free of shadows? Is the marked lesion clearly in view and in focus? If so, you're ready to move on to your second photo. Here, we want to capture as much detail of your skin lesion as possible for a thorough assessment. If possible, having someone else take a detailed photo for you might make it easier to ensure proper focus and lighting on your lesion. First, position your camera so that the marked lesion makes up the central 70 to 80% of the frame. Be sure that the entire ink border surrounding the lesion is visible within the edges of the photo. Check for shadows in the frame and be sure to hold the camera still to avoid any blurriness. One tip here is to stabilize the arm you're using to hold your phone with your own body, or you can rest it on a tabletop to help your camera achieve and maintain a detailed focus. To get as much detail as possible in the photo, utilize the zoom and metering features on your phone's camera, holding the phone as still as you can while pointing to your lesion, and either tap the screen to focus or pinch and drag your fingers to zoom. Tapping the screen on the area of focus and letting the camera re-meter will often achieve a picture with clearer detail on a macro level. Another photo tip for iPhone users: with the camera app open, you can use the volume buttons on your phone to take a photo. Some users find this easier to hold steady rather than trying to tap the screen. Take a look and review your photo. Is the ink border surrounding the lesion clearly seen? Is the photo in focus? If both photos meet the criteria of these guidelines, confirm them along with your confirmed medical and lesion history. You'll be prompted to pay a one-time screening fee that will officially submit your history and photos to be assessed by a certified dermatologist who will then be in touch within 24 to 48 hours. In some cases, your provider may determine that they cannot make an accurate assessment based on your submitted photos. If that happens, you'll receive an email and a notification in the app to upload new photos. We're still on the case. Just need to make sure that your lesion is captured as clearly as possible.